and welcome to Time with Lydia, the pharmacist. Today we are going to be talking about syphilis, and our focus is on the signs and symptoms of syphilis in both men and women that you need to know of. Syphilis is a sexually transmitted infection and it is caused by a bacteria. It can be transferred through anal sex, vaginal sex, or oral sex, and sometimes it can be passed on from a pregnant woman to her baby, sometimes even through breastfeeding. The infection starts as a small sore that is painless and typically appears on the genitals, mainly the vagina, the penis, or the rectum. And the spread of the infection would occur when there is direct contact with the source. After the infection, syphilis can stay in the body without causing any symptoms at all. But the infection can become active after so many years, and when it is not treated in the long term, it can cause complications in the body. Without treatment, syphilis can damage the heart, the brain, and some other major organs, and it can be life-threatening. When syphilis is detected early, it can be treated with antibiotics. That is why when you start experiencing the symptoms, it is appropriate or essential that you visit your sexual health clinic or your doctor for immediate check and treatment. The symptoms of syphilis occurs in stages. So today I'm going to take you through all the different stages and the symptoms that are likely to occur at each stage. Sometimes these symptoms might overlap and they might not even occur in this order. So bear that in mind. Once you develop any of these symptoms at all, make sure you get a checkup. So the first stage is known as primary syphilis. And at this stage, you will develop a small sore around the genitals, that is on the penis, in the vagina, or around the rectum. Most people would have just one sore, but some people would develop more than one sore. This sore can be painless, and it normally appears at the spot where the bacteria entered the body. Typically, it would appear in the vagina, around the penis, or in the rectum area. The sore normally forms 3 weeks after you have come in contact with the bacteria, and most people would not even notice that they have it because it is painless and because of where it develops. Also, it can heal on its own within 3 to 6 weeks. Now, the second stage is known as secondary syphilis, and at this stage you would develop a rash whilst the sore in your genital area heals, or a few weeks after it heals. A rash that is caused by syphilis is often not itchy. It may look rough, red, or reddish brown based on your skin color. Sometimes it might be so faint that you would not even notice it. The rash normally starts on the trunk of your body, that is on the chest, the stomach area, your pelvis, and your back. And it can also appear on your limbs, the palms of your hands, and the soles of your feet. Additionally, during secondary syphilis, you can develop other symptoms such as hair loss, muscle aches, tiredness or fatigue, weight loss, swollen lymph nodes, or wart-like sores in the mouth or the genital area. Symptoms of secondary syphilis will go away on their own, but without treatment, they can come back and stay on for a long time. Now let's move on to the next stage of syphilis, which is known as the latent stage. If the condition is not treated, it moves from the secondary stage to the latent stage. The latent stage is also known as the hidden stage because at this stage, you don't experience any symptoms at all, but the condition is still there and it can last for so many years. But without treatment, it can cause a lot of major health conditions known as complications. Now, the next stage of syphilis is known as tertiary syphilis. After the latent stage, up to 30 to 40% of people with syphilis who don't get treatment have complications called tertiary syphilis. syphilis. At this stage, the disease may damage your heart, your nerves, your eyes, your liver, your blood vessels, your bones, and your joints. And these problems may happen many years after the untreated infection. So the key message today is that make sure you get a check as soon as you develop any unusual rash in your genital area, that is in your vagina, on the penis, or in your anal area. Also get tested for syphilis if you have had sexual contact with someone who might have the infection. If you have another sexually transmitted infection such as HIV, if you regularly have sex with more than one partner, and if you have unprotected sex, that is sex without a condom. Also, if you're pregnant. Without treatment, syphilis can cause a lot of damage to the body. So don't hesitate in phoning your doctor or your sexual health clinic for a thorough check anytime you develop the symptoms. I hope this video is helpful. Please don't go away without giving it a thumbs up. Share with your family and friends. If you haven't yet subscribed to this channel, please hit on that subscribe button and also on the notification bell so you don't miss any of our informative content. Leave your questions and your comments in the comment section. Thank you once again for your time today, and I hope to see you soon in my next one. Bye for now.